So let me introduce you to our three panelists here. First, we have Becky Preve. Give a wave. She's the executive director at the Association on Aging in New York, and they support and enhance the capacity of New York's local area agencies on aging, and works in collaboration with the whole aging network to promote the independence, preserve dignity, and advocate on behalf of aging New Yorkers and their families. It's a really wonderful association. And before joining there, she was a director at the Franklin County Office for the Aging. Don't know if we have anyone from Franklin County out there. And she also was an acute care social worker, so she's got plenty of experience. And she also serves as a board member for numerous organizations and programs, which I thought, when I looked at her bio, was really nice and very cool. Next, we have Kathy Kanaley. She has a long career working with older adults in the community and healthcare settings. She integrates social work in the civil legal work of the Center for Elder Law and Justice, where she works. And she is the supervising social worker there. Her leadership in supporting, educating seniors and those who work with older adults spans across all of Western New York. So thanks for coming here repping Western New York. She facilitates the Erie and Niagara Council on Elder Abuse and is on the executive committee of the Erie County Coalition Against Family Violence. She coordinates MDT Hub. She serves on numerous boards, and she received FBI's 2024 Community Leadership Award, which also I thought was very cool. All right, and then finally we have Brad Hasenauer. He's consulting manager of the advisory and consulting division at the Bonadio Group. He focuses on fraud and forensic accounting. He's provided forensic accounting and other services to a lot of organizations, including a lot of public nonprofit organizations. He's worked extensively on financial exploitation cases for older adults, working in 55 different counties in the state. He's also been an expert witness, so I'm really happy to have Brad here today to talk a little bit about safeguarding money. So let's get started on the content here. Article 81 of the New York State's mental hygiene law is where adult guardianship comes from. And it's just always really important to remember that you need to make sure that lesser restrictive alternatives are explored in order for a guardian to be appointed. It is required that the court look at all available resources. And so if you look at 8103, section 8103 in Article 81, it even defines available resources and talks about how it's visiting nurses, home health aides, adult daycare, senior centers, and then POAs, trusts, things like that. But it's named in the statute there. And so these things really all need to be explored and are required by law to be explored. And there are also a couple of cases in the CLE material showing examples of when available resources were considered by the court to be enough and when they weren't. So you can take a look at those if you're interested in more about the legal standard there. But now I'm just going to turn it over to Becky to get her portion of the presentation going. I will share my screen. Let's see. Can you see that? Is this working?
Yes.
Okay, perfect. Let's go to yours. All right, take it away.
I don't see mine yet, Deena.
Oh no. What about now?
No, I see that cover page.
Deena, I think you have to swap screens between, I think we're seeing the presenter side of the slideshow that kind of shows the notes, the next slide.
Okay, hold on. This worked before, huh?
I would sing for all of you, but that would be disastrous.
Okay, let me try again. How about now?
There we go.
Okay, great.
So hi and welcome everybody. As Deena said, I'm Becky Preve. I'm the executive director with the Association on Aging in New York. And really wanted to first and foremost start off by thanking all of you for the work that you do. It's my understanding the majority of you are all in some way, shape, or form touching the lives of older or vulnerable individuals. Those jobs are incredibly difficult, and I'm hopeful for what I'm going to talk about today may help you in your professional or personal journeys moving forward, because I think that there's a lot of missed opportunities among professions as far as information sharing and collaboration on how we can really serve, specific to the work that we do, the older population in the state of New York. Next slide, please. So I always like to start with a little bit of a boring kind of level set on aging, because it's very, very frustrating in the work that we do when we talk about the older population being a dredge on society, having all these needs, not giving back to the community. And quite frankly, those things are just not true. There are a segment of the older population that do need assistance. But when you talk about equity issues for older adults, specifically about funding for programs that actually protect older individuals or support not-for-profit guardianships, that really becomes an equity issue, because if you look at the state of New York, older individuals pay about $72 billion per year in state and local taxes, and contribute about 43% of the overall GDP in the state. So we really need to invest further in programs and services that support older individuals and support the infrastructure that's there to support them. And again, you guys know this, the rising population in the state is really those over the age of 60. If you look statewide, the only cohort that we're gaining population density in are those over the age of 60, but the fastest growing segment of the overall population are individuals over the age of 80. When you tie that into the fact that we're losing demographics under the age of 60, you're losing those informal caregivers, family supports, while you're also increasing the older population. And what a lot of people don't clearly understand is that in the state of New York, even though we're home to almost 5 million people over the age of 60 and another 4.1 million caregivers, we only have 111,000 licensed skilled nursing facility beds in the entire state. So the solution to these really high need individuals is not going to be institutional care, not only because it goes against what a lot of people want in their lives, but there's just not the physical capacity to make an assumption that if someone's unsafe in the community, that they can get a physical placement at either assisted living or skilled nursing facility placements. Next slide. So again, when you look at the trends and the demographics, I hope this isn't a surprise to any of you. We're seeing a decrease in married couple families, a decrease in married couple families with children. We're seeing an increase in single parent households, also non-traditional households. And then when you look at what that means for the 62 counties in the state of New York, you can see here in 2020, we only had 9 counties with 30% of their population over the age of 60. In another, it's crazy, in another 5 years, we're going to have 33% of our counties where over 30% of their population are older. And as all of you know that work in health and human services, we don't have capacity today to serve the needs of the people we're trying to serve. So we really need to think about how we can coordinate and collaborate to make sure that we pool our resources moving forward to be able to meet those growing needs of that older population, all while ensuring individual safety and security. So we have a lot of work to do for sure. Next slide. Again, this won't be surprising to any of you that do this work. We know that chronic conditions are the #1 major cause of illness, disability, and death in the US. A lot of you deal with individuals that have medical self-neglect, where you see a lot of hospitalizations, a lot of non-compliance with medication adherence. And what's interesting that if you look at the cost of the chronic condition issue, it's $864 billion by 2040. So again, we need to also figure out how we can help people have better medical outcomes, manage their chronic conditions through whatever care journey they're going through in order to make sure that we can reduce those costs. And again, when you look at the New York State population of individuals with a disability, 35% of people over the age of 65 will have one of those issues. So a lot of the populations that you're working with are dealing with exactly these types of issues. Next slide. So this is where the fun part comes in. So you'll hear me talk about AAAs. They're known as Area Agencies on Aging in the state of New York. That's our federal designation, but a lot of you refer to your local AAA service as your local office for the aging. So we do have 62 counties in the state of New York. We have 59 predominantly county-based AAAs in the state. We obviously, New York City aging is the 5 boroughs. We have 2 Native American Indian tribes. We have 1 shared county office for the aging. And really what those 59 AAAs do is they receive funding from New York State Office for the Aging. And so we have a mix of federal, state, and county dollars that are to serve the populations that we're trying to serve. And then those 59 actually contract with almost 1,200 subcontractors in the community. Excuse me. What's really cool about that is that they have built this really significant network where although there might be an office for the aging, there might be a not-for-profit that's actually doing the work to support older individuals. And that's where resources can really come into play to help you with the work that you're doing. So we have almost 800 senior center sites, over 800 congregate meal sites. We have 315 central kitchens. We have over 2,000 home delivered meal routes. We're actually the largest home delivered meal provider in the country, which is something that we're really, really proud of. And then we do a lot of interventions that actually work to prevent ongoing chronic conditions, increase health outcomes. We run 41 of the highest level evidence-based interventions through the AAA network. And I have to update my numbers. We're now well over 40,000 older New Yorkers that we've served through those. That's like health promotion activities, Tai Chi for arthritis, chronic disease self-management, falls prevention programs. And again, these are no-cost programs that you can engage your clients with. We also have over 900 HICAP and LitCop volunteers. A HICAP volunteer is a trained individual that can refer and address health insurance and health insurance plans with customers. If any of you have ever worked with somebody that's turning 65, they are flooded with mail about different Medicare Advantage plans. Some of them see commission sales reps. Our HICAP staff and volunteers are state certified to give only objective information so they can protect people's best interests with their health insurance plans. Next slide. So who do we serve? So every office for the aging really is targeting to serve 4 different groups of customers. So first and foremost on the prevention side, we want to be able to assist that individual that might be turning 65, might have a health insurance question, might not know what Part D plan to get for prescription medications. So really those individuals that don't need a lot of service, but maybe need a touch point with their local office for the aging. We also provide volunteer opportunities through our offices for the aging. And then we kind of move into those individuals with chronic conditions, might need minor assistance, might need one of those evidence-based interventions, might need to talk about future planning options, advanced directives, those types of things that we can assist with. Then we move into those individuals that are really at a higher risk. And we're looking at those for potential poor health outcomes. Those individuals may be at risk of emergency room visits or nursing home placements, and really need that hands-on care. And I'll get into what we actually provide hands-on in the next slide. But those are individuals who really are at a crisis point, and either themselves or a loved one or a family member really need to come up with a plan on how they can keep an individual in a home or community setting. If we do need to provide assistance in securing a skilled nursing facility bed, we do a lot of advocacy at hospitals and skilled nursing facilities. And really that hands-on intensive case management service for those individuals. And then we also have a really robust respite and caregiving support program for individuals that are actually providing care for a loved one. Next slide. So this is a really fun part. What do we actually do? A lot of people think of an office for the aging just as meals and bingo. And although those are things that we actually do on a daily basis, it's only one small part of our overall portfolio. And why it's so important that if you're working with an older person, that you absolutely make the connection to your local office for the aging, because there might be things that can be provided that are going to assist you with a client that you're working with, or even prevent a family from having to look down the pathway of legal services interventions. So obviously we do provide home delivered meals. The nice thing about the home delivered meal program is it's not just that it's a hot home delivered meal, it's really a health and safety check. So a lot of times when people are coming out of an acute hospital stay, a home delivered meal referral might assure that discharge planner that an individual will be visited every day. And if they don't answer the door for that meal, then we will take action to make sure that individual is safe. So it's a health and safety check at the same time. Again, we provide congregate meals across the state in different settings. Our congregate meal sites are really a wonderful place to provide education to older people, for them to interact with one another socially, for us to provide education and training. We do a lot of work through our senior center sites and congregate meal sites to talk about protecting yourself from financial exploitation and scams. So it's a really good way to touch those individuals who don't really have high needs, but are connected with an aging services provider. We also have registered dietitians in every corner of the state that can provide nutrition counseling and education services. Those are done in group settings, mass mailings, but also can be done one-on-one. If we identify an individual has issues either with obesity or malnourishment, the registered dietitians can either do that over the phone or during a home visit. We talked about the health promotion and wellness programs, really focusing on the fact that the more you can do in your younger, older years will prevent those ongoing chronic health conditions that can cause real disability and the need for a higher level of care. Respite and caregiver supports, I'm going to talk about this in a little bit more detail. What we are finding, and I don't know how many people are on the call currently, but about half of you on the call today are in a caregiver role. Most of you don't identify you're in a caregiver role because you say, I'm just a mom, I'm just a son, I'm just a friend. And what we're finding post-pandemic is that the emotional and economic just turmoil that caregivers face by trying to provide either financial assistance to a loved one or being on call 24/7 or trying to navigate the system while working full time, is that caregivers are actually abusing substances at 5 times the general population, and they're having active suicidal ideation 3 times more than the general population. So caregivers are absolutely in crisis. I'm sure you guys see this either in your own lives or when you're working with families. Caregiver supports are something we take really seriously, that we're trying to address statewide to make sure that we can help those caregivers in their care journey. Because you guys know this, when caregivers break down and say, I can't do it anymore, that's where guardianships sometimes come into play, because there's nobody that's still willing or able to provide any assistance. We do provide legal services. Unfortunately, the budget for legal services is very limited. But we are able to provide legal services to lower income individuals that might want to do estate planning, healthcare proxy, living wills, those types of things. Of note, we can't handle divorces or bankruptcies. Those are the 2 that are excluded from the work that we do. We provide home modifications and repairs. So if someone needs a wheelchair ramp or a grab bar or a tub cut in their home to be able to remain there, we're able to assist with those things. Elder abuse prevention and mitigation. Speaking to the choir on this one, preventing elder abuse is something we take really, really seriously. You guys know this because of the growing population and those over the age of 60, they're the perfect target. They're also sitting on pensions and Social Security benefits. If you took New York City out of this demographic, about 83% of older people own their own homes and have home equity. So they are absolutely a place that gets targeted. And then when you talk about the issues with the healthcare system and then caregiver breakdown, the risk of an older vulnerable person being physically abused or exploited financially just continue to increase as we see problems in the community. The one that I really want to highlight for you guys is the New York Connects program. So the New York Connects program, and I have the 1-800 number on a following slide. The New York Connects is really a place to go birth to death for any question that you may have. So New York Connects, you should be able to call and say, I have a child that I think needs to get early intervention programs. New York Connects should connect you to the appropriate resource, all the way up to calling New York Connects to say, I can't do this another day, I can't take care of mom. Are you able to help me? So really, if you're looking for a takeaway from this call on how you can get engaged with your local office for the aging, that's your go-to. Each New York Connects office has their own individual number, but if you're looking to get connected and don't have the time, you can call the 1-800 number. They will dispatch you to your local county. I talked about the health insurance information counseling and assistance program. We're very proud of that program. We've put hundreds of millions of dollars back into the pocket of older individuals who are eligible for like the Medicare savings program or weren't in the right plan in the first place. And then we also offer personal care level 1 and 2 home care services. So personal care level 1, again, is that light housekeeping, grocery shopping. Level 2 is the hands-on bathing, dressing, toileting. And what's really wonderful about the programs that we provide is that we kind of fill in that space between Medicaid and private pay. So obviously, if someone is eligible for Medicaid, they can get those services under their Medicaid benefit. But again, if you live in the state of New York and you're making, $1,700 a month in income, if you're below that, you can get Medicaid. But if you're making $2,200 or $2,300 a month, you can't afford to privately pay $40 an hour for a home health aide. We come in and subsidize those services for the non-Medicaid eligible individuals. And I will tell you guys, we have a waiting list for this service because it's so popular. So we constantly on our advocacy platform really push for additional dollars to be able to serve people in our personal care program. But it's a wonderful tool to be able to assist individuals to remain in the community. And just to give you kind of a snapshot, our average client that's receiving these services is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions like diabetes, congestive heart failure, and needs assistance with activities of daily living. So it's exactly that type of individual that's really high risk for going to another setting. We're able to serve them in homes and communities on average for about $10,000 per year. So we're a massive cost savings to the Medicaid system. And that's really our return on investment conversation when we're talking about providing preventative home care services instead of making people impoverish themselves to Medicaid in order to receive services. We also provide comprehensive case management. Again, I think where we can tie in really well with other human services providers is that our case management staff, we're the only state in the nation that actually mandate by law that our case managers are state certified through Boston University of Social Work. And so our case management are not time limited or acuity related. If you get a case manager for either home care services or home delivered meals, that case manager could follow you for your entire journey. It might be years and years and years that you're on our program. You will be case managed the entire time. And that case management includes home visits on a regular basis, a comprehensive service assessment where we go through everything from, is this person agreeable to work with tech products? Are there trip hazards in the home? What's the family dynamic like? So really, really well in tune with the services that are provided and the individuals that they're serving. We provide personal emergency response systems. A lot of people think of those as Lifeline. I will tell you in the last couple of years, the home monitoring systems that we're piloting throughout the state are mind-blowing, using infrared technologies or cameras, really a lot of work being done there. We pay for social adult day services so people can go to work and have a loved one go to an adult day program. We provide transportation to medical appointments. And again, if you have Medicaid, Medicaid will pay for this service. There's no other payer. Medicare doesn't pay for transportation. Private plans don't. So we subsidize transportation for individuals that need assistance in getting to medical appointments. And then we also oversee the long-term care ombudsman program, which is obviously the nursing home watchdog program to really report any issues that you're seeing in those types of settings. Next slide. So I was multitasking. I did see a couple questions in the chat. What's the eligibility? Because everybody's going to think that there's a catch, right? Our eligibility criteria for our core services that I talked about, you have to be over the age of 60, or you have to be providing care to someone over the age of 60. Our core services, so those home delivered meals, the personal care hands-on services, those do require an in-home assessment and a care plan, which is done by our case management staff. Their home care services specifically are for non-Medicaid eligible individuals. I will tell you there, for 95% of our programs, there is absolutely no cost. We have one small home care program under ISEP, which will take into account your income. And you could potentially have a small cost share with those services. Most of our individuals that we're serving do not have a cost share because they're right at that gray area between Medicaid and non-Medicaid. And we can also work with an individual if they do have a cost share to see if we could put them in another program or another funding stream to actually provide that care. And we are working, I don't know if it'll pass or not, just based on how the legislature works. We are putting forward a bill to try and waive the cost share component for home care services. but for the most part, there's no cost. Those other services that I talked about, legal services, home modifications, etc., there is no cost associated. We do send out suggested donation contribution letters if someone is able to contribute, but really the programs are free after assessment. The information and assistance portion of the work that we do, that is absolutely free to any individual that wants to access that type of service. Next slide. I want to be very mindful of time. And you guys will have my email address. If you want to follow up with me offline, I'm more than willing to. What I wanted to get in front of you is we're doing a ton of work on public and private partnerships to combat social isolation and loneliness. And wanted to make sure that you're aware that some of these programs are completely free. So you can walk out of this webinar, go visit with one of your clients and literally give them this information to access. We've seen a significant return on investment. If you want to look at the full listing of all the innovations that we're working on, there's a link here for you, or you can go to New York State Office for the Aging website to check those out, but really wanted to highlight a couple of the free ones. So next slide. So we talked about caregiving. What we did about 2 years ago is we realized that caregivers in the state of New York were completely overwhelmed. They weren't receiving supports in the way that they needed to. And so we partnered with Trualta. We're the only state in the country that Trualta is free for anybody in the state of New York. It's an online caregiver platform. Again, there's some statistic listed here you guys can read. I put the log in there. The amazing thing about Trualta is instead of you having to Google and look for caregiver supports, it literally asks you a couple questions and then you only get information about your caregiving journey. So if I'm dealing with someone with a cognitive impairment and sundowning issues, I'm only going to get information on that versus if I'm caring for someone with a spinal cord injury, I'm going to get information about, combating pressure sores and how to appropriately do transfers. Trualta customizes to you. So you can either do a podcast, you can print materials, you can watch videos. We have seen amazing results for caregivers that are using Trualta. They also just launched, which is super popular, a completely anonymous online peer-to-peer support program. No cameras are turned on, names are not included, and people are able to just get on and talk about their care journey. I would tell you guys, anybody that you're working with, any colleagues, share Trualta. Again, it's completely free. And we're seeing really good data and metrics coming out of the work we're doing with them. Next slide. Get Set Up is also another wonderful platform. It provides over 5,000 classes for older individuals. Your first classes that you take are how to use your iPhone and your iPad and how to Zoom. And then you can do so many different things. There's over 40 categories of classes, multiple languages. We've hit the 500,000 mark. Most popular classes are for health and wellness, but you can take classes on photography. You can take tours of museums. It's completely free for any New Yorker. Again, if you're over the age of 50 and you want to teach a class, if you're good at guitar playing or have another talent, you can actually get paid by Get Set Up to provide training for those classes. Again, completely free, share away. Next slide. This is the really feel-good one. So we've also worked with Ageless Innovation and Joy for All Companion Pets. If you guys haven't seen these, check them out. They're unbelievable. We have distributed over 35,000 pets across the state. These are a real feel-good win. We give them to people with cognitive impairments who don't understand that they're not real pets, all the way up to people that know that they're, a robotic animal, but can no longer change a litter box or bring a dog out. They also have walker squawkers, which Velcro to a walker. And if you get up and walk away from your walker and don't take it with you, the bird will freak out and remind you that you need to go back to get it. They also have intergenerational games that play on stereotypes of different age groups. So a really great way to do multi-generational initiatives. And again, these are available through any office for the aging. If someone is out of stock, feel free to reach out to me because we are continually doing additional orders. But sometimes just a wonderful thing that you can bring even as an icebreaker for someone that you're trying to work with. So very proud of that platform. Next slide. And this is EliQ. EliQ is our AI robotic care companion robot. This is super cool, but kind of freaky. The little light on top actually moves with you like the Pixar lamp does in the Disney movies. But EliQ learns with you. So if you have her in your house, she talks to you so much that she actually is able to garner your day-to-day activities, what you like, what you don't like, what your sleep patterns are. And so LEQ will actually prompt you. If I told her 3 days in a row I didn't sleep very well, and then the fourth day, LEQ, I had a really good night's sleep, she'll ask me, Becky, what did you do the night before? And if I tell her I listened to a meditation or, you know, whatever I did, she'll remind me that night, hey, guess what you should do tonight? Also tells you to take your medications, is able to video chat with family members. You can also tell LEQ, I want to take a trip to Paris, and she'll bring you to Paris and have a virtual cup of coffee with you. Our case management staff can actually be linked to the LEQ unit. So the individual could say, if I was their case manager, hey, LEQ, call Becky. Also, it will ask me about my mental health. It will ask me about my physical health. And if I report I'm having significant pain, it will then prompt me, do you need to call your primary care physician? We have over 900 of these units deployed, seeing amazing results with them. They are not free yet for the entire state of New York, but I just wanted to show you guys something kind of sexy and cool that we're doing in aging, because this is just one of those public-private partnerships that I talked about that you can check out online. Next slide. And then this is the last one that I think is a really, really great resource. Any of you that work with staff would completely understand this, because not only do you have to train staff on all the programs and services that are available, you might be working with individuals who need to apply for different public benefits, but don't know how. And so what we've done is we've created a video tutorial through New York State Office for the Aging, where it literally is a videotaped interaction of someone filling out an application. So line by line, how to do a HEAP application, line by line, how to do a SNAP application, line by line, how to do a Medicaid application. So it's a tool you can give to families that are seeking access to benefits. It's also something that a lot of my members are actually using for staff to train their staff on how to do some of these types of things. Again, completely free. You can access that online. Next slide. And then here you are on the New York Connect side of the house. That's the 1-800 number statewide. These are our 9 regional EMDT hubs. And I just want to kind of end by saying, I know I went through this really quickly. I think the takeaway needs to be, there is a complete and total understanding, at least through my network at the area agencies on aging, that there are not enough resources to support the individuals that you guys are seeing and you guys are trying to work with, those really high needs, those really high vulnerability points. It doesn't mean that we can't partner with you to try to provide other preventative services for families before they hit that benchmark, or even for guardians who don't know they can access programs and services through their local office for the aging. Like, we really need to make sure that we're coordinated in our approach and how we're serving people, because we want to see people thrive and do the best that they can, while also understanding there's a huge gap in the number of guardians available for individuals. And there's not enough funding that's provided to support the programs and services. Adult Protective Services obviously has issues as well as far as their capacity. And so I always like to say it does take a village. I want to say it takes a state, and we're just really here to partner and help you in any way that we can, moving the needle on some of these issues, while at the same time, you know, I'm always very clear on this. We have capacity issues within our network. We have waiting lists, but we're really good at our jobs and we really want to be able to help. So I'm barely over time. I apologize. But again, my email is right here. Feel free to reach out if you guys have any additional questions.
Thanks, Becky. I'm gonna ask a few of the very short questions right now that are just related to some of the programming that you mentioned. Do you know does LEQ speak foreign languages?
I don't believe so. I believe they were beta testing Spanish, but I can find out.
Okay, great. And I see who asked the question, so we can respond to them later. And are nursing home residents eligible for all of these as well? Robotic pets, LEQ, things like that?
We predominantly provide those services to people in homes and communities. I will tell you, in special circumstances, we have provided them to skilled nursing facilities for individuals that really would benefit. But, and you guys know this, quite frankly, that skilled nursing facilities should be able to provide these types of services to the residents. But, you know, definitely reach out to me if you have a case where you're like, this would really be beneficial, and maybe one could fall off the truck.
Thank you. And then finally, The care program, the personal care programs you mentioned earlier, are they in any way like CDPAP where you can choose the person, or like who are the providers?
So we use the same licensed home care agencies that Medicaid does. We also run the consumer directed program, but not in every county. So I want to say out of the 59 AAAs, I have 42 that provide consumer directed. So it would depend on the county, but yes.
Great. Thank you so much, Becky. And hopefully we'll have some time for more questions at the end. Kathy, I'm teeing you up. And while you get yourself ready, I'm going to read the first CLE code. I'm only able to read it out loud. I'm not able to put it in the chat as per CLE policy. It is 417 and the letter K. 417K. K as in kitten. K also as in Kathy Kanaley, who is our next speaker. 417K. Please write that down. I won't be able to repeat it later. 417K. Kathy, are you ready to go?
Yes, I am. Thank you.
All right. You can put your video on when you're ready.
Okay. All right. Hi, everybody. Thank you for inviting me to participate on this panel today.
Ooh, sorry to interrupt. Your the microphone is still a little low. I don't know if you can move it closer.
Okay, how's this?
It's definitely a little better. Thank you.
All right, great. Thanks for inviting me to participate on this panel today. I started at the Center for Elder Law and Justice 24 years ago as a social worker for the Guardianship unit. I realized very quickly that serving as a guardian was a tremendous responsibility. Making decisions, sometimes life and death decisions, for people we didn't know or who often couldn't tell us what they wanted. So we began to look backwards and work backwards. What did or did not happen to folks who ended up in our care?
Hey, Kathy, people are still having trouble hearing you. I know you have a microphone plugged in. Do you want to try unplugging it maybe? Do you have a built-in microphone that's different?
Here we go. Okay, how's this? Better?
I can hear you better now.
Okay, great. So we started to work backwards with our guardianship folks to see what happened or didn't happen that resulted in them becoming under our care. And the first was abuse. Abuse generally at the hands of trusted caregivers, neglect, emotional abuse, physical abuse, and mostly financial exploitation. The next was self-neglect. Those folks who fought to the very end until a crisis occurred when an agency, mostly adult protection, had to step in and take them out of the situation in order to keep them safe. And the third was there just wasn't anybody else but our agency to serve as guardian for a person in need. So our goal was to challenge communities to be proactive rather than reactive to persons who might otherwise need a guardian. And we can do this using the many touch points for elder adults that were mentioned in Becky's slides. The first is education and awareness. We're making a big push in our area to get people thinking about life planning or advanced planning. The healthcare community really is doing a great job on getting folks to talk about their healthcare needs, their future healthcare needs, using both a healthcare proxy or a living will or a MOST form. We are also looking for folks to consider doing a power of attorney. And again, we have to be careful with the power of attorney because it is probably one of the most often used documents for financial exploitation. We need to make sure people understand the importance of a power of attorney, what the document can and cannot do, and stress the responsibility that the person who has been given this authority has. So again, educating those providers in the many touch points that Becky mentioned is one of our goals. And executing a will. The generational wealth of the baby boomers is estimated to be $4 trillion. The generational wealth of Generation X is estimated to be $30 trillion. So again, having our older population being prepared ahead of time before very critical decisions have to be made is most important. When folks begin to need some assistance, next slide, Deena, please. Okay, next slide, please. Okay, so when people, and again, we're working with our providers in the various agencies that Becky mentioned. When folks may need some assistance and oversight, keeping in mind all along that most people want to stay in their homes as safely and independently as possible, what are some of the resources that can be put in place? We'll go back to education. Some of the risk factors could be isolation, change in activities, strangers in their lives, all things that people at congregate dining sites, at respite, at the Office for the Aging, those people who work with older adults need to be educated on what to look for, warning signs that may indicate a person might need some assistance. One avenue would be the use of a representative payee. Most of our older adults have Social Security, maybe a pension, maybe some investment, but a representative payee, adult protection in many cases in many counties can serve as the representative payee for an older adult. This at least protects some of their income from potential financial exploitation and will ensure that people can pay their bills on time, their basic bills on time, their shelter expenses. There are avenues for folks to become representative payees for various pensions, and also a process in place for someone to become a fiduciary through the veteran system. Both Social Security and the VA do ask for an annual accounting from the representative payees, so there is a system in place for check and balances to make sure that that person who has assumed the responsibility for that income is using the income in the best interest of the client. They're using the client's money for the client's needs and the client's wants. Again, there is an annual accounting that people will be held responsible for if they are assigned as rep payee. Also, there are available certified money managers. These folks can become powers of attorney or fiduciary. They are generally certified by a financial institution and they are bonded. They charge a fee for this service, but again, they can become the watchdog for people's money to make sure that their bills are being paid on time and accurately, preventing any type of financial exploitation. Lifespan out of Rochester has a program called Future Care, which they use. It is a package for all types of advanced planning, and the money management is part of that. In our area, there's a geriatric care management program, Laping Surde, who has a couple of certified money managers who have really made a difference between someone being able to stay home and pay their bills and keep the lights on and having to be moved from their home, most likely to either the home of a relative or an institution. The ABLE accounts are tax-free saving accounts for those who are on SSI, SSDI, blind, and determined disabled before the age of 26. This is an account whereby adults and young adults primarily can put extra money, say they're working a part-time job, they can put that money into the ABLE account and maintain their benefits that they're getting through Social Security disability or SSI or any of the programs, again, mentioned by Becky, that are covered by Medicaid. Pool Trust. Pool Trust, there's a site, New York Health Access site, that lists a number of pool trusts in New York State. Pool trusts are vehicles that allow folks to use funds that may otherwise render them ineligible for benefits. For example, folks who want to apply for Medicaid and can benefit from Medicaid services can put what is their spend down, the amount of money that would render them ineligible, into the pooled trust. The pooled trust then can then pay household expenses, education, other approved expenses out of that money that's in the pooled trust. All of the people in the pooled trust, money is joined and the interest is assigned to each individual's account. The pooled trust is exempt by Medicaid, and the after fund, or the money that's in the trust after a person passes away, will be used for the benefit of other disabled folks. It is something we are seeing here in Western New York that has made a huge difference in adults being able to stay in their home. They can get Medicaid, they can get the services that Becky mentioned, and yet the money that would otherwise either go to Medicaid or render them ineligible is now accessible for them to pay for out-of-pocket expenses. So again, what can we do to help folks stay safely in their homes? A new program, relatively new to us here in Western New York, is our financial management volunteer program. This program started in Lifespan in Rochester through the New York State Office for the Aging, and it is a program where trained volunteers visit clients who are having difficulty maintaining a budget and paying their bills on time. It is 100% client driven. What we do is we recruit volunteers, and our volunteers to date have been professionals, retired folks, or people who have had personal experience with a loved one who's gone through a program or a situation where they've had trouble maintaining their budget. We do reference checks on our volunteer applicants, a thorough background check. They are insured. They go through a lengthy orientation program, and then monthly they are given training on different benefits, how to apply for SNAP, how to apply for HEAP. Tax season's coming up. We don't expect our volunteers to be expert on every situation that may come up, but what we do expect is that when they identify a need that a particular client has, they can at least address it or refer it back to us to help that person with the situation. As far as our clients go, clients can either self-refer, they're over the age of 60, and they have a demonstrated need for someone to help them with their finances. We have seen a lot of referrals from widows who've lost their spouse, who typically handled all of the business in the family, and they're struggling to make ends meet, not knowing what to pay first and how to pay it. So what we do is we have a social worker go into a client's home first and triage the situation. What money's coming in, what money needs to go out. Usually there's only 5 or 6 bills a month that have to be paid. We offer to do a credit report to make sure that the bills they do have are in fact their bills and that they haven't been a victim of identity theft. And then we introduce a volunteer, and that volunteer will help them follow up with what the social workers have identified as needs, and also apply for benefits. We work with credit card. We are seeing the highest 2 debts that we are seeing older adults who are in this program have are credit card debt and medical debt. So what can we do to help those folks lower their debt and live within their means? This program has been so successful in the short time that our agency has been involved. We are now in Erie, Niagara, Wyoming, Cattaraugus, and Chautauqua County. And again, it's making the difference between someone having to leave their home to go elsewhere for financial reasons. The volunteers go through the mail. They make sure they're not getting scammed. We've already discovered folks who were being scammed by Spectrum when they had their big scam going. We are looking at their bank statements. We can see that, you know, they pay 6 bills a month, their shelter expenses, and maybe 1 credit card. If there's any other money coming out of there that they don't have an explanation for, then we can offer to refer that to our elder abuse unit or help them in any other way that we, working with the bank itself to see what that was. We also look at the shelter expenses. Are they getting heat? Are they getting any tax breaks they are entitled to? So we go through each county's benefit list with the client to make sure that we are maximizing their benefit and freeing up as much money as possible to have them live as comfortably and as safely as possible. What's been very interesting is that most of our clients do not want their children to know that they might be struggling. And this is because if they demonstrate that they can't pay their bills, is that then the entree for a family member to say, well, mom or dad, maybe it's time that you give up the house and move into an assisted living or senior apartment or whatever. So again, our goal is to keep people as independent and making their own decisions as possible. So our program is great. It's growing now through Monroe and the 5 counties around Monroe, and then our 5 counties. So we have Western New York pretty much covered, and hopefully at some point New York State will find the funding for other counties to join in on this really, really successful program. The last thing I want to talk about is our efforts in the community to form what we're calling a coordinated community response. There's a community response team in Niagara County, although it focuses on elder abuse. Again, if you look backwards to see what preventative measures could have been put in place to eliminate the possibility of financial exploitation, that's where we want to be. So our Council on Elder Abuse is a group of providers in the area. We meet monthly, we talk about resources, we network, so we know that we can make those connections to hand people off so they can stay on the continuum of services in order to stay as independent as possible. We do want our providers, though, to identify those at risk for early intervention. We have an arrangement, CELJ has an arrangement with the Alzheimer's Association to help execute powers of attorney and healthcare proxies before the person with Alzheimer's gets to a situation where they're no longer able to express their own wishes. So that's a wonderful program that we're working with the Alzheimer's Association. We have a med law program where we have an attorney, paralegal, and a navigator who work in different healthcare systems in our area who will help execute a power of attorney, a healthcare proxy. The navigator is responsible for linking folks in the hospital with services post-discharge, in addition to what a hospital discharge planner might do to ensure that this person can stay home medically stable, eliminating those high costs that Becky mentioned about repeated hospital visits. We also have the Family Guardian Support Project here at our agency, and that's through a Ralph Wilson grant. And that grant allows an attorney to work with those family guardians to sort of get through the paperwork that is needed for reporting purposes for those who are appointed guardian. Again, our goal is to keep people, there are so many services in place, some of us not even knowing what the other does. So trying to get these community coordinated community response groups together. So we don't drop the ball, that a client can go from one agency to another agency to have their needs met in a way that's appropriate for them at the time they come into the system.
Hey,
The older we
Kathy, I
get-
just want to be mindful of the time now.
I'm-
It's 1:57. I want to make sure that we get to Brad's materials.
Okay, all right, I'm finishing here. I just want to finish by saying that the older we get, the more important maintaining our independence in decision-making becomes. So we want to make sure that we have the resources in place and coordinate those resources to make sure that that happens for our older adults. Thank you.
Kathy, thank you so much. And thanks for leaning into that microphone. I'm going to turn it over to Brad real quickly, but hopefully we can answer a couple of questions at the end. And the programs CELJ has are amazing and so large in number. Brad, take it away.
Thanks, Deena. You can go ahead and go over to my next slides. So basically, I'm going to talk about some tools and stuff like that very quickly. I know we're limited on time, so I just want to respect everyone's time. But basically, my job here today is discuss some of the tools you can utilize that are out there with your financial institutions, with your credit bureaus that you guys can use, that I've learned over the years working with, hundreds of financial institutions and on over hundreds of financial exploitation cases. But basically, I wanted to start with some facts. Financial exploitation of older adults is obviously a growing concern. Many of you have probably seen that in your own experience. The FBI reported that losses from elder fraud has increased by 84% in just 1 year, reaching over $3.1 billion in 2022. Now, to that point, the DOJ just recently released their 2024 review. You guys should go check that out. It has a lot of useful facts in there that they collected as well, and they found some similar stats on financial exploitation of older adults. Another fact I wanted to share is from the National Adult Protective Services Association, or NAPSA, that basically estimates that for every one case of financial exploitation that gets reported, 44 go unreported. So it's very important to kind of utilize tools that are out there to kind of help you prevent and, not have to do such strong measures such as a guardianship. Next slide, Deena. So some of the account monitoring service at the financial level, obviously on the back end, you have your banks utilizing tools such as AI and machine learning to kind of review your financial history on your statements. They're reviewing your transactions, reviewing your history. Where do you go? Where do you shop? But also, as we know, similar to my home Wi-Fi system, even technology fails from time to time, and it has no reason on why it does or why it happened or how you could have prevented it. So it's always good to add these extra layers of protection. One of which is transactions alert via text or email. If you're financially savvy or your older adult is financially savvy, obviously set them up with it. But obviously, you can have a trusted individual sign up for them as well. Basically notifications for large withdrawals or deposits. If any unusual large amount is withdrawn, transferred, spent, or the account holder is going to immediately receive an alert, or that trusted individual on the account. I'm actually a trusted individual for my grandmother's account. Just set up alert systems for her. That way, if anything crazy leaves her bank account, I'm notified via text message immediately. Also, setting daily withdrawal spending caps or withdrawal limit will help minimize losses. We're creatures of habits. If I've never done a transaction over $500 in my life, I don't think I randomly will once I become an older adult. Just an example of that. Deena, we lost the slides.
Oh no, I will fix this. What do you
No
see
worries.
right now?
Just your name, but I can kind of go off of memory from my slides if there's a problem. But transactions alert for unusual locations or odd times, right? So Scammers often try and make repeated small transactions to avoid detection. We've seen that before. So setting up alerts for, multiple withdrawals within a short period can be super helpful to kind of catch that before they, withdraw too much money. In my own personal life, it's happened before. When I was in college, I was home, my credit card got swiped at a gas station. They were trying to make small purchases in my hometown while I was away at college. I had transactions alert set up at the time, which was able to contact me, and then I was able to kind of dismiss those charges and close that credit card on the spot. It also works for, online or out-of-state purchases, right? So if a transaction occurs in a location where the account holder typically is not present, they receive an alert. For older adults, this is great. Clearly, they may not be traveling as much. Why not set up those alerts for anything out of state, just to add that extra layer of protection, right? So, for example, you have a retired individual who, had his debit card stolen, and a fraudster attempts to withdraw $500 or $800 at an ATM in another state. Since it's a unusual location, they've never been or haven't been in a while, that transaction will be flagged and sometimes even prevented if you set up these alerts. So, setting up customizable alert settings, just kind of exploring your options at a financial institution is a great idea. The bank wants to help you just as much as they want help from you. So it's good to set up these thresholds for transactions, as well as, specifying the types of transactions to monitor, right? So like those online purchases that I discussed before, if you have an older adult or you're an older adult that doesn't really utilize online purchases, why not set a transaction alert up for that? Some banks might even prevent online purchases to be made, which is another great step, since, if you're not going to utilize it, why not just kind of shut off that option? Next slide, Deena. Getting on to the other side of things, right? So we talked about what you can do at your financial institutions with credit cards, banks, etc. But with the credit monitoring services, you can also set up notifications for credit card or credit inquiries and accounts open. So any sort of new thing, again, you can be alerted for that. They can also alert you for changes in credit score, potential identity theft. We've had cases where, someone opens up multiple credit cards in their name, racking up debt on all those credit cards, plummeting the credit score. That individual had alerts set up for either new credit card inquiries or even alerts in change in credit score that could have been prevented. And if you catch it early enough, it wouldn't have been such a headache for, APS and local law enforcement to essentially write up a report to basically report to these credit agencies to dismiss the debt, to kind of explain that this individual was financially exploited. If you catch it early enough, you can kind of get that debt dismissed, rightfully so, obviously. And, one little tidbit I wanted to share is, per the FTC, the three national credit reporting agencies, Equifax, Experian, and TransUnion, have permanently extended a program they started during COVID, where you get free credit reports on a weekly basis from all three agencies. So utilize that service. It's out there. It's free, just like all the other services I mentioned on the credit monitoring side and on the account monitoring side. All these services are out there for you to utilize. Next slide. Caregiver tools, really quick, providing read-only access to bank statements is a huge service you can utilize, as it's not necessarily allowing people joint owner, which many of us in the investigative world have an opinion on. Joint owners on account, we've seen how it can go bad, but providing read-only access is one step kind of in that direction without giving full control over to your bank accounts. You can also allow trusted individuals, as I've discussed before, to receive, duplicate statements or alerts to review. I know my father, who, knows the kind of work I've done, already wants this to get set up immediately as soon as he's hitting retirement age. So I know I'll be reviewing their bank accounts. Multi-factor authentication, or 2FA, is huge in the IT world. So utilize it if you can. I know it can kind of be a pain at first to, read a code that they send to you and then enter that in. But the fact is it prevents so many issues and so much, unwanted access to your account. Not only do they need a password, but they need access to that code that gets sent to you. It's a huge way to prevent a lot of unwarranted access. If you never use a debit card, consider locking it, especially if it's lost or stolen, or a credit card. Same thing, close out anything you don't utilize. Account freeze, going to back to the credit agencies. A bank can temporarily, hold suspicious transactions while they're confirming the legitimacy, but also you can freeze your credit at all three major bureaus, blocking unauthorized credit applications or, basically any sort of impact on existing accounts, right? If you have a HELOC, close that if you don't plan on using it. We see a lot of that out there in the financial exploitation world. And again, quick and easy thing you can do is setting up alerts and setting up daily withdrawal and spending limits. If you know how much you're going to spend, if you know you're not going to apply for credit, make sure to set those alerts, make sure to set those freezes. It's going to prevent a lot of headache down the road. I know that was quick, fast, and so if I went over anything too quickly, I was just up against the time limit. So I just want to get that out there. But if you are ever a victim of, financial exploitation, there are tools out there. There's things like EverSafe. There's things like Fraud Finder that we have that can help kind of explore how much was taken and where money went. And again, my contact information will be available. I'm always up for a conversation. I love discussing this industry.
Thank you so much, Brad. And you got a compliment in the chat from someone who you worked on did forensic accounting on a case for them before. So Brad is well loved for his work, and rightfully so. I want to give the second CLE code before I don't. Give me one moment. The second CLE code is R5, N as in Nancy, 3. R5, N as in Nancy, 3. I'm going to give it one more time. I am not able to put it in the chat. R5, N as in Nancy, 3. And yes, I will be sending again out the materials that you need to send in order to get your CLE credits. With the couple of minutes we have left, I do want to mention that we had a couple of questions and comments that were not quite related to this content. If you have questions related to guardianship, my organization has a helpline. I have information that I should be putting up on the screen, but as you've seen, I'm having some issues with that today. There it is. The number is 718-750-8474, but also you can find it at projectguardianship.org/helpline. Also, you have my email address from when I sent materials out. If there's any issues in guardianship that you just want to discuss, which some people reached out about in the chat and in questions, I am always happy to talk about that. I also just wanted to, since we're talking about alternatives, I'm going to stop share again. Just mention that as a reminder, the extent to which some things are available really depend on someone's condition, finances, insurance, their social network, their access to facilities, access to transportation, and that we all really, as a society and community, need to be thinking about this and how we can make sure that people are able to access as many of these alternatives as possible. It's been found that the promotion and implementation of many alternatives, they're just not promoted as much in certain communities. There's a study that's in the Justice and Aging brief that I sent out before and will send again about how Black adults are 4 times more likely to have no advanced healthcare planning compared to their white counterparts. That's just something to think about. We also often think about rural communities and transportation and internet and things like that, and being able to access different services, especially ones that are in person. And so I recommend that all of us, including me and my organization, with our programs as well, really be thinking about how to reach out to every community, think about the language that's in our promotional materials, how we can engage other people in the community to share peer-to-peer, and all sorts of things like that. I do know that there is a question related to if someone's trying to get someone's services and they feel like they are kind of teetering on the edge of capacity to consent to things. Becky or Kathy, maybe this question is for you. How do you handle situations like that where someone's referred for a program, but it's unclear where their decision making is at, really, their ability to engage with services?
So I can jump in really quickly, at least through Offices for the Aging, because obviously we don't handle capacity cases. We don't do those assessments, but we absolutely can provide support to try and go in, do a home assessment, see what the living situation is, and then if we feel it's appropriate that we need that type of intervention or screening, we would work with Adult Protective Services or other service providers. If they had family willing and able to assist them to try to get them in for an assessment, but we would just try to help partner in that. But we don't have the ability to go in and make those determinations. I also know that the EMDT hubs also work with gerontologists who can assist with that as well. I don't know if Kathy wants to speak to that.
Yeah, I was just gonna say in the very beginning, when we see that people might be needing services, it's difficult. And what we were trying to do is, and in some cases, it's unfortunately just going to have to take a crisis before anybody can really intervene and make a difference. But the enhanced multidisciplinary team have two services that make it enhanced. One is Brad in the forensic accounting, and the other one is a geriatric psychiatrist. And this person, we have two actually, who work out of the University of Rochester. They actually have a capacity clinic. You do need a referral from the person's primary physician, but they will do an in-depth assessment of someone's capacity. For the MDTs, what they help us with is reviewing medication and past medical records to determine whether or not a person may or may not have had capacity at the time that they signed a document that then was used against them. So there are resources out there. We ask Adult Protection when we work with Adult Protection to make sure that if they're involved with a case with us, that they can get whatever medical records we have to give a picture of where that person is in terms of their mental and decision-making capacity. And then we kind of work with that. But sometimes it takes multiple attempts to get someone to realize that there's help out there. Most people equate help with a sign that you're taking away all my right to self-determination, and that's not it at all. We want to make it safer for you.
Thank you so much, Kathy. So we're out of time now. I will be making sure that the slides will be sent, the affirmation and evaluation will be sent, and then other CLE materials and just learning materials. I will send them all out again to anyone who registered for this program. We have another one coming up that's going to be talking about guardianship reforms. We're going to be learning about some things happening in other states, but also a lot about what's happening in New York State and the changes that hopefully we can look forward to as everyone is trying to make the system better and make more alternatives better. Thank you so much for attending, and thank you so much to these panelists. I am so sorry for the technical difficulties. Zoom was not my friend today. And I hope you come back for the next one. Thanks, everyone.
Thanks, everybody. Bye.
Bye.